Stomach pain and diarrhea, causes and prevention. Some common causes of abdominal pain and diarrhea include food sensitivities, bacterial or viral infections, and the medication or alcohol use. Treatment can depend on the cause. Diarrhea may be acute and occur suddenly, or chronic and develop slowly and last for a few days. It is best to contact a doctor if a person frequently or persistently experiences abdominal pain and diarrhea. The doctor can diagnose the underlying cause and help create a suitable treatment plan. Watch on to learn more about the possible causes of stomach pain and diarrhea, where and when to contact a doctor. Gastroenteritis. Diarrhea may result from a bacterial or viral infection of the stomach and bowel, which is called gastroenteritis or stomach flu. People may get bacterial gastroenteritis by eating or drinking contaminated food or water. Symptoms usually occur within a few hours or days of consuming the contaminated food. People may contract viral gastroenteritis, which some people call stomach flu, from someone who has the infection. Parasitic gastroenteritis can also cause acute diarrhea and stomach aches. Home remedies may help. This include drinking plenty of fluids, resting, and taking over-the-counter medications to ease discomfort. Medical treatment may be necessary if symptoms do not resolve on their own. Food intolerance. Food intolerance can potentially cause diarrhea, stomach aches, and other types of stomach problems. Up to 20% of people experience some type of food intolerance. Examples of possible causes of food intolerances include gluten, which is typically in pasta and bread; caffeine, which is in tea, coffee, and some fizzy drinks; alcohol, which may also be present in some foods or sauces; histamine, which is in cheese and wine; salicylates, which are present in some fruits, vegetables, spices, and herbs; sulfites, which are in beer, cider, and wine; monosodium glutamate, which is in some savory foods, cured meats, and ripe fruit. Keeping a food diary can help track which foods may be responsible for a person's symptoms. Remedies may include limiting or avoiding trigger foods, introducing new foods and dietary changes slowly, eating fewer rich meals. Dumping syndrome. Dumping syndrome can cause diarrhea and stomach aches. It happens when food moves too quickly from the stomach to the duodenum. Early dumping syndrome happens within around 30 minutes after eating, while late symptoms of dumping syndrome occur around 1 to 3 hours after eating. Dumping syndrome most commonly happens following stomach or esophageal surgery, such as weight loss surgery and esophagectomy. Remedies that may help include changing eating habits, medications such as octreotide, surgery if other treatments do not help. Irritable bowel syndrome. Persistent diarrhea can suggest a chronic condition such as irritable bowel syndrome. This condition does not damage the digestive tract but may cause symptoms including diarrhea, constipation, irregular bowel movements, stomach cramps, bloating, gas. According to the National Institute of Diabetes and Digestive and Kidney Diseases, about 12% of people in the United States have irritable bowel syndrome. A person can manage symptoms of irritable bowel syndrome by reducing stress, making dietary changes, getting enough good quality sleep, drinking plenty of liquids, getting enough regular exercise or physical activity, taking supplements at a doctor's advice, using medications. Inflammatory bowel disease. Inflammatory bowel disease refers to a group of conditions that affect the bowel, including Crohn's disease and ulcerative colitis. According to the Centers for Disease Control and Prevention, around 2.4 to 3.1 million people in the United States have inflammatory bowel disease. Symptoms can include diarrhea, abdominal pain, bloody stool, weight loss. Inflammatory bowel disease may result in damage to the digestive tract. It is therefore essential that people with the condition manage their symptoms to help avoid further damage. Treatment aims to reduce the inflammation that causes bowel damage and digestive symptoms. Options include medication, dietary changes, surgery. Stress and anxiety. Stress and anxiety can stimulate bowel movements, which may result in diarrhea and stomach aches. Stress can also trigger the symptoms of irritable bowel syndrome, which can include diarrhea. There is a link between the brain and the gut, which may explain why stress can lead to digestive problems. People can reduce stress by trying meditation and mindfulness, getting enough regular physical activity or exercise, deep breathing techniques, art or music therapy, spending time outdoors. A doctor or mental health professional can recommend medications, therapy, or a combination of both for persistent or severe stress. Medication. Some medications can cause stomach problems, with many medications listing diarrhea as a side effect. In most cases, drug-induced diarrhea will resolve a few days after a person either stops taking the medication or reduces the dose. However, it is important to continue to take any prescription medication until a doctor advises otherwise. It is best to contact a doctor if a person experiences any ongoing or severe side effects after taking medication. Alcohol. Alcohol can interfere with digestion and lead to stomach pain, diarrhea, vomiting, or other symptoms. People might consider limiting alcohol intake to avoid these issues. The International Foundation for Gastrointestinal Disorders suggests that beer and wine, in particular, may cause diarrhea. Pregnancy. Diarrhea and other bowel changes can occur during pregnancy, potentially due to hormonal and structural changes in the body. Changes in dietary habits and new food sensitivities can also cause diarrhea during pregnancy. Diarrhea may also happen close to labor. Contact a doctor for a checkup and advice if diarrhea persists during pregnancy. Less common causes of diarrhea and stomach aches. Other potential causes of abdominal pain and diarrhea include appendicitis, gastrointestinal surgery, certain types of cancer, cystic fibrosis, fecal impaction, intestinal obstruction. When to contact a doctor? People with diarrhea and abdominal pain should contact a doctor if symptoms are severe, get increasingly worse, last more than a few days, occur in infants, older adults, or people with weakened immune systems, reoccur regularly. Seek immediate medical help if diarrhea occurs with black, tarry, or bloody stool. Confusion, difficulty speaking, fever, nausea or vomiting, irritability, jaundice, rapid heart rate, seizures. Symptoms of dehydration such as dark urine, thirst, dry mouth, and fatigue. Vision problems.